Have you ever wondered what happens when doctors suspect pancreatic cancer? It's a journey that can feel overwhelming, but knowledge is power. Let's break it down. Today, we're diving into the diagnostic process for pancreatic cancer, because understanding what's ahead can help you feel more in control during a scary time. They're looking for those red flags in your symptoms and medical history. Have you been experiencing unexplained weight loss? Abdominal pain that won't quit? These could be clues, but they're just a starting point. Hey there, I'm Dr. James from Pancreatic Cancer Warriors. This is called staging, and it's super important for determining your treatment options. PET scans or laparoscopy can show if the cancer has moved beyond the pancreas. It's like creating a battle plan. You need to know what you're up against. Imagine this. You're sitting in your doctor's office and they've just mentioned the words pancreatic cancer. I know, it feels like an eternity when you're waiting for answers, but here's why it matters. Thorough testing saves lives. It ensures you get the right treatment for your specific situation. So push for answers, absolutely, but understand that your medical team is working to get you the most accurate information possible. Going through this diagnostic process can be scary, frustrating, and exhausting. Great question. Here are a few tips. Write down all your questions beforehand. No question is too small or silly. Your input, questions, and observations are invaluable throughout this process. Bring a friend or family member to appointments for support and to help remember information. Keep a journal of your symptoms and any side effects from tests. This can be incredibly helpful for your medical team. It's okay to feel all of those things. In fact, it's normal. Don't be afraid to lean on your support system or seek professional help if you need it. Or perhaps it's sharing this information with someone who needs it. Whatever it is, take that step. Your health and peace of mind are worth it. The more you understand about the diagnostic process for pancreatic cancer, the more empowered you'll feel. Don't keep those thoughts to yourself. Reach out to your doctor, connect with support groups, or subscribe to Pancreatic Cancer Warriors for more empowering guides, just like this one. And that's exactly why we at Pancreatic Cancer Warriors do what we do. There's a whole community out there ready to support you every step of the way. This is Dr. James from Pancreatic Cancer Warriors, signing off. Stay informed, stay empowered, and remember, knowledge is your most powerful weapon in the fight against pancreatic cancer. Your mental health is just as important as your physical health during this time. Your heart races. But here's the thing, suspicion isn't diagnosis. There are support groups, online communities, and organizations like Pancreatic Cancer Warriors here to help you every step of the way. But knowledge removes fear. Right. A biopsy is how doctors get a definitive answer. Using a tiny needle, usually guided by EUs, they take a small sample of tissue. This goes under a microscope, where experts can confirm if cancer cells are present. It sounds scary, but it's a crucial step in getting you the right treatment. But here's the catch. It's not foolproof. Think of it as one piece of the puzzle, not the whole picture. Your doctor might order other blood tests too, building a more complete view of what's going on inside your body. There's a whole process to confirm or rule it out. Ready to learn what comes next? First up, the initial consultation. This is where your doctor becomes a detective. They give doctors a clear view of your pancreas, showing any tumors and their exact location. It's like having a roadmap of your insides, but sometimes we need an even closer look. That's where MRI or endoscopic ultrasound come in. These can provide even more detailed images, helping doctors plan the next steps. Now, let's talk blood tests. I ever heard of CA? It's a tumor marker that doctors often check. Next on the list, imaging scans. This is where things get high-tech. CT scans are the gold standard here. Now, here's the part that often makes people nervous. The biopsy. But wait, there's more. If cancer is confirmed, doctors need to know if it has spread. Here's a critical insight. This whole process can take weeks. Now, let's pause for a second. Are you feeling overwhelmed? That's totally normal. Remember, you're not alone in this. Let's recap what we've learned. The diagnostic journey for pancreatic cancer involves 1. Initial consultation, spotting those red flags. 2. Blood tests, looking for tumor markers. 3. Imaging scans, getting a clear picture of what's happening. 4. Biopsy, the definitive answer. 5. Staging workup, understanding if the cancer has spread. Each step brings you closer to answers, and more importantly, to the right treatment plan for you. Here's something crucial to remember. Early detection can make a world of difference. Imagine catching pancreatic cancer before it has a chance to spread. That's why being aware of the symptoms and pushing for thorough testing is so important. But what if you're reading this and you're not facing a cancer diagnosis? Knowledge is still power. Understanding these steps can help you be a better advocate for yourself or a loved one in the future. It's like having a roadmap before you even start the journey. Let's talk about the emotional side for a moment. Now, you might be wondering, what can I do to prepare for these tests? Remember, you're not just a patient, you're a crucial part of your healthcare team. As we wrap up, I want to leave you with this thought. Knowledge removes fear. Want to learn more? Have questions about what we've discussed today? Remember, whether you're going through this journey yourself or supporting someone who is, you're not alone. So, what's your next step? Maybe it's scheduling that doctor's appointment you've been putting off. Thanks for joining me today.